Introduction. Pharmacotherapy for gastroesophageal reflux disease, GERD, is a complex area of study that involves the use of various medications to manage the symptoms and complications associated with this condition. In this script, we will delve into the different classes of drugs commonly used in the treatment of GERD, their mechanisms of action, and their impact on the pathophysiology of the disease. Additionally, we will explore the evaluation of GERD severity, potential complications, and the role of pharmacokinetic drug interactions as well as pharmacogenomics in optimizing treatment outcomes. So, let's dive into the world of pharmacotherapy for GERD. Gastroesophageal reflux disease, commonly known as GERD, is a chronic condition characterized by the reflux of gastric contents into the esophagus. The primary goal of pharmacotherapy for GERD is to reduce the frequency and severity of symptoms such as heartburn, regurgitation, and chest pain. Medications used in the treatment of GERD include proton pump inhibitors, PPIs, histamine H2 receptor antagonists, antacids and alginates, prokinetic agents, mucosal protectants, and combination therapies. Proton pump inhibitors are the most commonly prescribed medications for GERD. They work by irreversibly inhibiting the hydrogen-potassium ATPase enzyme in the parietal cells of the stomach, thereby reducing the production of gastric acid. Commonly used PPIs include omeprazole, esomeprazole, lansoprazole, pantoprazole, and rabeprazole. PPIs provide superior acid suppression compared to other drug classes and are highly effective in managing GERD symptoms. Histamine H2 receptor antagonists, such as ranitidine and famotidine, work by selectively blocking H2 receptors on the parietal cells of the stomach, leading to reduced gastric acid secretion. Although not as potent as PPIs, H2 receptor antagonists are still a viable treatment option for mild to moderate GERD or as an adjunct in combination therapies. Antacids neutralize gastric acid and provide symptomatic relief in GERD. Aluminum hydroxide, magnesium hydroxide, calcium carbonate, and sodium bicarbonate are commonly used antacids. Alginates, such as sodium alginate, form a foam-like layer on top of gastric contents, providing a physical barrier against acid reflux. Antacids and alginates are frequently used for on-demand relief of mild GERD symptoms. Prokinetic agents, such as metoclopramide and domperidone, enhance gastrointestinal motility and increase lower esophageal sphincter tone, reducing the frequency of acid reflux episodes. These medications are particularly useful in patients with delayed gastric emptying and associated GERD. Mucosal protectants, such as sucralfate, form a protective barrier over the mucosa of the esophagus and stomach, preventing damage from gastric acid and pepsin. Although less commonly prescribed, mucosal protectants can be beneficial in managing certain complications of GERD, such as esophagitis and peptic ulcers. Combination therapies, involving different classes of GERD medications, are often employed to achieve optimal symptom control and healing of esophageal mucosa. For instance, a combination of PPIs and prokinetic agents can provide enhanced acid suppression and improved lower esophageal sphincter function, resulting in better outcomes for patients with GERD. Transient lower esophageal sphincter relaxation, ULSR, is considered the primary mechanism responsible for acid reflux episodes in GERD. ULSRs are brief relaxations of the lower esophageal sphincter, allowing gastric contents to reflux into the esophagus. Understanding the role of ulcers in GERD pathophysiology can guide the selection of pharmacotherapeutic agents that target this mechanism, such as prokinetic agents. Assessing the severity of GERD is important for tailoring the pharmacotherapy and monitoring treatment effectiveness. Various evaluation tools are available, including symptom questionnaires, esophageal pH monitoring, endoscopy, and histological evaluation of esophageal mucosa. Clinicians use a combination of these tools to determine the severity of GERD and customize the treatment approach accordingly. Untreated or poorly managed GERD can lead to complications, including esophagitis, strictures, Barrett's esophagus, and even esophageal cancer. Pharmacotherapy aims to prevent or reduce the risk of these complications by optimizing symptom control and preventing acid damage to the esophageal mucosa. Pharmacokinetic interactions occur when one medication affects the absorption, distribution, metabolism, or excretion of another medication. Some GERD medications, such as PPIs, can interact with specific drugs, altering their effectiveness or increasing the risk of adverse effects. Understanding these interactions is crucial for safe and effective pharmacotherapy in patients with GERD who may require concurrent medications for other medical conditions. Pharmacogenomics explores how an individual's genetic makeup influences their response to medications. Genetic variations can impact the efficacy and safety of GERD medications, including PPIs and other drug classes. By identifying genetic variations, clinicians can tailor the medication regimen, dosage, or switch to alternative drugs to optimize treatment outcomes. In conclusion, Pharmacotherapy plays a vital role in managing gastroesophageal reflux disease, GERD. By understanding the mechanisms of action and interplay between different classes of medications, clinicians can make informed decisions to alleviate symptoms, prevent complications, and tailor therapies based on individual patient characteristics. Additionally, evaluating the severity of GERD, managing drug interactions, and considering pharmacogenomics can further enhance treatment outcomes. As research progresses, new pharmaceutical interventions may emerge, providing even better options for patients suffering from GERD.